Well, it's the question millions of Americans have asked. Should I get a COVID-19 vaccine? I asked two local doctors that question, and their answers echo healthcare professionals across the country. Dr. Scott Robertson, president and CEO of the Pacific Central Coast Health Centers for Dignity Health, says the mRNA vaccines from both Pfizer and Moderna are incredibly safe for all people who are eligible to receive them. He says it's extremely effective, especially in preventing severe illness and death. But who should not get a COVID-19 vaccine?
There's really only one category of patients, and those are those who have had severe reactions to previous vaccines or one of the other COVID vaccines. And so an example might be an anaphylactic or severe allergic reaction, which would cause somebody to be hospitalized or interrupt their breathing in a severe way. Outside of this, having other types of chronic conditions would not preclude anyone from getting a COVID vaccine.
Another San Luis Obispo County doctor is also urging the vaccine for most of his patients.
Anybody who can be vaccinated should be vaccinated. It has shown itself to be extremely effective at doing what it was designed to do, and that is keep you from getting extremely ill and keep you out of the hospital.
Robertson says the mRNA vaccines have been shown to be safe for the millions of pregnant women in the United States that have received them. When it comes to everyday illnesses, he says getting a vaccine can be postponed temporarily, not avoided entirely.
For people that are undergoing a type of acute illness, so if you're acutely sick with a respiratory illness or a GI illness or hospitalized with another illness, it may be okay to postpone getting the vaccine until you feel better. But certainly that wouldn't preclude you from getting the COVID vaccine either.
The type of issues you would think about are severe allergic reactions. If there's components to this vaccine where you've had anaphylaxis, life-threatening allergic reactions, obviously you shouldn't take it. If you are on very active chemotherapy where your immune system is in terrible condition at that point, why would you take the risk at that point?
Robertson went on to say for people with chronic illnesses like lung disease, heart disease, and diabetes, that's a group that should be prioritized for getting the vaccine.